Thank you for joining us today. Today I'd like to give an overview of pivotal response treatment. There's a couple of underlying basic assumptions with pivotal response treatment. The first one is intervention in the natural environment. There's a lot of studies now that are showing that if you remove a child from the natural environment, they just don't develop typically. And this is true with children with autism. We really want them to be exposed to all of the myriad of things that happen in their natural environment and be able to interact with their typical peers who will be wonderful role models. The second assumption is family involvement. Years ago, families were excluded from the intervention, but now we found that not only is it important to have family involvement, but the families are a critical part of the intervention process. We really need to have the families involved and learn the procedures. There's a couple of components with that. One is that unfortunately, when a child is diagnosed with autism, the families are instantly under really a lot of stress. This is some area that really needs a lot of research. It's very stressful for a family to have a child diagnosed with autism. We would hope that our society would come together and support the family and give them everything that they need so they don't have to feel that stress, but unfortunately at this point that doesn't happen. The second component is parent education. What we found is if we can teach the parents specific procedures to use, then the parents can implement the intervention throughout the child's waking hours. And this is important because you don't always have a therapist around on the weekends or after school and holidays and things like that. We need the intervention to be consistent, which brings me to the next point, coordination across all environments. We know that children learn faster when all of the environments are consistent and coordinated. So we like to have all of the environments coordinated. And the last area is treatment of pivotal behaviors. What we really are looking for are pivotal areas that we can treat that will cause positive improvements in lots of other untreated areas. And this is so important because the early interventions targeted single behaviors and it took so long and the children learned so slowly. And most of the time the children didn't even like the intervention. They kicked and screamed and tried to get away and didn't like the intervention. So we looked at different pivotal areas that we felt could really improve and have widespread improvements in the children's functioning levels. So we've researched at the University of California in Santa Barbara. We researched a lot of different areas that we found have been pivotal, in other words, have these positive changes in lots of other behaviors. One of them is motivation, and I'll talk about that a lot today. That's what I'm focusing on today. Another area is multiple cues. If we can get the children to respond to lots of different simultaneous cues, that seems to be helpful. Initiations is a huge one. If we can get the kids to initiate, it really helps long-term outcomes. Self-management is another area that if we can get the children to and adults and adolescents to take responsibility for their own behaviors and in a sense become their own therapists, then that makes a big jump in their gains. And the last area that we're in progress is empathy. We're realizing that a lot of individuals, because maybe with autism, because they're maybe not as social when they were younger, they don't really learn the empathetic responses that they need to know, but once they learn them, it can really make a difference with relationships, with interpersonal relationships, conversation, and a lot of other areas.